So before going to discuss about the visual field defect, let us see what actually happens when image is formed on the retina. So this is the visual field, the area which can be seen by each eye. The inverted image of this visual field is falling upon the retina, which can be visualized, and this is perceived by the nervous system. So visual field is called as the visual space which can be seen by each eye. So area which is seen by each eye is called as visual field of that particular eye. Each retina and its corresponding visual fields are divided into four quadrants, and retina is subdivided by a vertical line, this one, and a horizontal line, and they are intersecting at the center, which is called as fovea. This region is called superior visual field. This region is called inferior visual field. This is called as nasal field, and this one is called as temporal field. The corresponding vertical and horizontal line of the visual space, these are also called as meridians, and they intersect at the point of fixation. This is the point of fixation, and the point in the visual space that falls on the fovea. So this region actually falls on this point of fixation in the visual field actually falls on the fovea, and this can be visualized properly by the fovea. The crossing of the light rays diverging from the different points on the object at the pupil causes the image of the object in the visual field to be inverted and left and right reversed on the retinal surface. So whatever you are seeing, the image is being inverted, uh, and it is also being uh, flipped, that is the left and right. The object in the temporal part of the visual field. So the object of the temporal part of the visual field, look at this, the temporal part of the visual field. The object of the temporal part of the visual field is seen by the nasal part of the retina. Here is also the temporal part of the visual field is seen by the nasal part of the retina. The object of the nasal part of the visual field is seen by the temporal part of the retina. Similarly, the object in the superior part of the visual field, this one, the superior part of the visual field, are seen by the inferior part of the retina. So this is the part of the retina. Inferior part of the retina is responsible for getting the collections of the informations which are coming from the superior part of the visual field. So like this, the image is formed in inverted form, and retina is sensitizing this image. So look at this one. This is the superior field. It is being perceived by the inferior part of the retina. Similarly, the inferior field, it is being seen by the superior part of the retina. Similarly, nasal part of the visual field is being visualized by the temporal part of the retina, and temporal part of the visual field is being seen by the nasal part of the retina. And you can see here all these are inverted. Okay, so when this is called as the monocular field of vision. So this is the monocular field of vision. These are in the monocular field of vision. This is for the right eye, and this one is for the left eye. And when these two fields actually submerge, uh, it creates the binocular field of vision. So this is the binocular field of vision. Okay, and this is this is visual field of left eye. This one is the visual field of the right eye, and they are being superimposed in this particular region. This is called as the binocular field of vision. and the peripheral part, this is the part of the monocular field of vision. This is the part of the monocular field of vision. So what is nasal field of vision? Nasal field of vision, the area seen to the nasal side, and the temporal field of vision, the area seen to the temporal side. That is called as nasal field of vision and temporal field of vision respectively. So visual field, it can be measured by a technique which is called as perimetry. So perimetry, it is the process by which the field of vision of the each eye is performed to diagnose the blindness in a specific portion of the retina. And why this is performed? This is performed to find the blind spots within the retina or in the visual field. If we cannot see a particular part of the visual field, except the this blind spot, this one, it is at the level of 15 degree. So other this area is the defects. What I can say that are the defects of the visual field if we seen any abnormality in this area. So visual field, it is very important to measure the visual field. The measurement of the visual field is very, very important or essential for a particular eye. So this is the perimetry chart. Okay, from center it has been marked as 10 degree, 20 degree, 30 degree, 40 degree, like that. Okay, so within the visual field we can find a particular region which is called as blind spot. It's found around 15 degree lateral to the central point of the vision. It is caused by the lack of rod and cone cells in the retina over the optic disc. So if you look to the optic disc, so in case of optic disc is the part where through which the optic nerve is passing or leaving the eyeball, and at that region rod and cone cells are absent. That's why at that region the blind spot is found. It is not visualized. So this is called as blind spot. So other than this area, if there is any defects, small defects in the visual field, that small defects in the visual field are called as scotoma. So scotoma, it is occasionally blind spots which are found in the portion of the visual field or the field of vision other than the optic disc area due to the damage of the optic nerve or the part of the retina also. So this is called as scotoma. Sometimes this scotoma may be caused due to the formation of the melanin pigments. So if the portion of the retina is degenerated and the excessive melanin pigments are deposited in the degenerated area, and this causes the blindness in case of the peripheral field of vision, and then gradually it can encroaches toward the central area, and this is called as retinitis pigmentosa. So this is formed due to the formation of the melanin pigment. That's why it is called as retinitis pigmentosa. Now let us see what are the visual field defects or deficits, whatever you can find. If you damage in the different part of the visual pathway, I will request you, if you are not going through the visual pathway, just go to my one video which I have already uploaded regarding the visual pathway, then go for this video. So visual field deficits, if we find the visual field deficits in a particular region of the visual retina, it can be divided into two types. One is anopia, another is scotoma. So scotoma is relatively the smaller visual field deficit, whereas the anopsia is relatively large vision field deficits, which are called as anopia. So anopia is defined as the relatively large visual field deficits. So damage to the retina, if you damage at the level of different levels of the visual pathway, different types of visual defects or deficits we can find. So likewise, just go to the first one. So if you damage this is the visual pathway through which the information is going up to the cerebral cortex, that is the occipital cortex for visual perception. So if you damage any part of this visual field, you can find the different defects. So let us see what actually happens. If you damage the retina or one of the optic nerve before it reaches the optic chiasma, it results in loss of the vision that is limited to that particular eye of origin. So that means if you damage here, or if you damage the retina, any part of the right eye, so the right eye vision field will be affected, and it is limited to the right eye only, not left eye will not be affected. And in contrast, if you damage in the region of the optic chiasma or more centrally, that means if you damage here and up to these regions, so both the eyes will be affected. Both the eyes will be affected. So it results in specific type of deficits that involve the visual field of the both the eyes. That is very important. So if you damage at the level of optic nerve or retina, it will affect the only that particular eye. If you damage at the level of optic chiasma and more centrally whatever you are going, so that means it will damage the visual field of the both the eyes. So let us see what actually happens if you damage the different parts of the visual pathway. So what actually happens. So if you damage at the level of the optic chiasma, if you damage at the level of optic nerve, the loss of the vision field of that particular eye is affected. Look at this. So the loss here, the optic nerve has been damaged. So if it is damaged, so then this region will be affected. Optic nerve can be damaged by accidentally, or the nerve conduction has been affected by development of the tumor in this region or like that, or any blood supply to this region, loss of blood supply to this region also. So if you damage at the level of optic nerve, that particular eye will be, a visual field of that particular eye will be affected. And if you damage at the level of optic chiasma, if you damage medially like this, this portion is damaged, so it is resulting in the loss of the visual field, and it is confined to the temporal visual field of the each eye. This is the temporal field, visual field of the each eye is being affected. Look at this. This is a black part. Okay. So this type of deficits or defects are called as bitemporal hemianopia. So bitemporal means the temporal side of the both the eyes, and hemianopia. It is also called as heteronymous hemianopia. So heteronymous, what actually happens in heteronymous hemianopsia? So if you damage at the middle of the optic chiasma, which results the loss of the vision, and it is confined to the temporal visual field of each eye, and it is known as bitemporal hemianopsia or heteronymous hemianopia. Individuals with these conditions are able to see in both left and right visual field, provided both eyes are open. However, all the information from the most peripheral part of the vision field are lost. So this is because as the temporal part is being damaged, so information from the peripheral part of the visual field is being lost. Now let us see what actually happens if the damage is at the level of the optic tract. So optic tract, it is consisting of the temporal fibers, that is the nerve, optic nerve, which are coming from the temporal part of the retina of the, suppose in this case from the right eye, and the nasal part of the left eye. So this one. So here, that means it is affecting both the eyes. So what will happen? It will cause the homonymous hemianopia. So this is called as homonymous hemianopsia. Anopia. The temporal part of the left eye will be damaged as the nasal fibers are being affected here. So nasal fibers are responsible for collecting the information from the temporal part of the visual field of the left eye. That's why the temporal part has been defects. And as the temporal fibers from the right eye is being damaged, so the temporal fiber is responsible for collecting the information from the nasal field, and that's why the nasal field of vision is being affected. So if you damage at the level of optic tract, then the homonymous hemianopia will be found. This is called as homonymous hemianopia. Again, the damage on the right results in loss of blindness in the temporal visual field of the left eye and the nasal field of vision of the right eye, what I told. Next, it is called as homonymous hemianopia. So homonymous hemianopia found due to the damage of the optic tract, and damage of the optic tract affects the corresponding part of the visual field in each eye, and there is a complete loss of vision in the affected region of the binocular visual field, and deficit is referred to as homonymous hemianopia. This type of deficit is referred as homonymous hemianopia. And next, we are going towards the optic radiation. So before going to the optic radiation, if you damage at the level of optic radiation, what is going to be happen? Before going to it, we just go through it, how the connection is going from the lateral geniculate body to the optic radiation. Look at this one. The connections from the lateral geniculate body to the occipital cortex is done by the optic radiation. So these fibers are going in two directional. Few fibers is going to the superior part, and it is representing the superior part of the retina and the inferior part of the visual field. So it is responsible for collecting the information from the inferior part of the visual field, and few fibers are going at the level of temporal lobe. So if these fibers are damaged, then what will happen? As it is representing the inferior part of the retinal quadrant, the superior part of the visual field will be affected for that particular eye. So let us see what actually happens if it is damaged at the level of superior part, inferior part. This is the inferior part of the optic radiation. So what will happen? The damage at the part of the temporal lobe, that means the inferior region. The damage at the part of the temporal lobe, that means the fibers. If you are damaging the fibers of the optic radiation at the level of temporal lobe, which will leads to defects in the quadrants, that is the temporal part of the left eye and nasal part of the right eye. So this is called as superior homonymous quadranopia. This is called as superior homonymous quadranopia. So it will be opposite, just if you damage at the level of the superior part, so inferior visual field will be affected. So this one will be affected. Okay. And if you damage at the level of, so what I told here, that is the inferior homonymous quadranopsia also can be found if we damage at the level of superior part of the optic radiation. And if the damage at the level of occipital cortex, that is all the fibers are being damaged, then what will happen? It will more or less similar like this one, that it means when you are damaging the optic tract, but it will left the few region, that is it is called as macula sparing. So macula, the informations which are coming from the macula region of the eye will not be affected, as because these fibers are following a different pathway. So the macular region will be left. Other than this macular region, the other part, that is the temporal part of the left eye and nasal part of the right eye, will be affected. So this is called as left homonymous hemianopia, homonymous hemianopia with macular sparing. So if it is damaged at the level of left side, left optic radiation, so it will also creates the opposite, that means the right homonymous hemianopia with macular sparing. When this portion will be affected, that is the nasal part of the left eye and temporal part of the right eye will be affected, and then it will be called as right homonymous hemianopia with macular sparing. Thank you for watching.